Hey everybody, welcome back, and it's story time. So today I'm going to relay an unfortunate incident that I witnessed at work recently. So we had a young lady come to us, and she had unfortunately been sexually assaulted a couple of months back. So she then relays the story to say she went to the clinic. When she got to the clinic, they tested her, pregnancy test, HIV test, and then started her on HIV prevention or prophylactic medication. So that's all they started her on. She went back at the end of the month for bloods, HIV testing, as well as a pregnancy testing. And at both times, the testing was negative. So keep in mind that sometimes our testings can be faulty. So then she proceeds to say each month she had been going on her periods, what seemed to be normal menstrual cycle. So she didn't suspect anything, but her stomach was growing. So she now presents to us, plus minus, it was an estimate of 19 weeks pregnant via the scan. And now she's devastated because this is an unwanted pregnancy. This is a very unpleasant pregnancy. So she was devastated, and I want you guys to take these 2 points that are very, very crucial. Number one, by law, the termination of pregnancy law does allow you to proceed to have termination of pregnancy beyond the 13/12 weeks gestational age, pregnancy age, because if you are a victim of sexual assault, or there is other factors such as the pregnancy is causing illness, terminal illness towards the mother, or the child themselves has terminal deformity or defects that are not conducive with life, then you are warranted to then see a medical practitioner and have access to termination of pregnancy beyond the voluntary ages. So she, by all means, had every right to come to the hospital and request termination of pregnancy. Number two, these things happen to us sometimes because of lack of knowledge. And it is important for us as individuals to educate ourselves. You can't fully rely on the health practitioner to do everything for you and to do it correctly. So what the clinic should have done was to assist this lady, because when you have an assault case, you need to receive prophylaxis for HIV as well as an emergency contraceptive. You need to be placed on emergency contraceptive. So unfortunately, the facility did not administer that. They only administered HIV prophylaxis, and therefore it led to this unfortunate outcome. So it is important for us to be, as individuals, educated so that you can remind the health practitioner that I'm supposed to receive 2 types of medications here. Or moreover, so that you can also advocate for yourself and be more alert when things go south. But also, please remember that the TOP law does allow a person to have termination of pregnancy beyond the 12 weeks in special cases. So I hope that was a good lesson. It's a sad story to talk about, but it is very important to our sexual and reproductive health understanding. All right, take care.